Our practice has always been based on sound scientific data that wasn't available to the early pioneers in hypnosis. That data and that science now allows us to enable the individual to make permanent behavioral change. That's what we are about, permanent behavioral change in the cognitive maps of the subconscious mind. We're not into wow. Yesterday we had an individual in the class that we inducted him with instant induction. And with instant induction, there's a brief second when the person isn't sure they're hypnotized. They're confused. You've bypassed the critical factor. And then you talk as fast as you can. You could actually give them your grocery list. As long as the words are coming real fast, then you do the suggestions. Well, that is wow and that's spectacular, but it doesn't have a place in hypnotherapy. Almost everything we do is going to be relaxing. So if you went down and you were to work with someone who's having eye surgery and you did an instant induction, you've not been hypnotized very often, if at all. And second, it's going to be very abrupt, because when you're doing surgery, you want to relax the person. You want to put them at ease, because one of the advantages of hypnothesia is there is no anxiousness. You can wipe out all the anxiousness, as well as the discomfort, and as well as the post-procedure constipation that comes from anesthesia. I'm sure you're aware that most of the pioneers of hypnosis from the 1850s on were scientists and doctors. We've covered that again and again. They were not entertainers, although sometimes their demonstrations were entertaining and evoked humor. Mainly that's because they didn't know what to expect. They had no idea what was going to happen. They didn't know what hypnosis was. But their main thrust was research and to discover what hypnosis was, what it was not, and under what conditions it would occur. These doctors and scientists were researchers proving and disproving the validity of hypnosis theories. Now, I'm a behavioral therapist, as is Dr. Chamberlain. We're both scientists of human behavior that utilize hypnosis and hypnotherapy in lieu of conventional talk therapy. I almost always have in the palette of people I'm working with 2 or 3 conventional talk therapists who really don't even want to hear about themselves using hypnotherapy in their practices, but they know there's something missing in their life or they wouldn't be seeking hypnotherapy. I've been working with one for quite a while now, and only now, after maybe 2 months, is she beginning to actually trust me. Now, I use, and Dr. Chamberlain uses, hypnotherapy over talk therapy because it is far more effective. As a side note, if you have an interest in the cognitive maps of the subconscious mind, one book I would refer you to is the seminal text by Downs and Stay, and we've mentioned this before, entitled Cognitive Mapping. We certify hypnotherapists and hypnotists in pain mitigation and hypnothesia at our center here. By the way, the hypnothesia I'm referring to is not the name of the band that your kids or grandkids are listening to. This is something totally different. It's a contraction of the words hypnosis and anesthesia. Hypnothesia. Hypnothesia is a valid alternative or an adjunct to chemical anesthesia. Some of the anesthesiologists and anesthetists that we have certified through the years in hypnothesia at first were only going to use it as an adjunct. But after a bit, you see, nobody gets an overdose of hypnothesia. You can't die from that. It then becomes an easier thing to do. So, if you Google hypnothesia, at least a few years ago, you'll find hypnothesia Bob Crow on the internet. I'm a general practitioner. We are general practitioners. we suggest you be general practitioners, but we practice hypnothesia as well. Hypnothesia is becoming recognized as a valid alternative to chemical anesthesia for colonoscopies. I did some of those this week. For cystoscopic examinations and ophthalmic surgeries and procedures. We could use it on a lot more, and you're going to find that if you want to pursue this, you're better off with a surgery center in lieu of a hospital. Today, this is an introduction to hypnothesia. This should not be construed as a certification in hypnothesia. We have also thought on our advanced 16-week course, maybe instead of doing regression, we'll do hypnothesia the last 2 weeks. Or, God forgive, heaven forbid, we might do 18 weeks and do regression and hypnothesia, but there probably won't be anything left of me. So this is not a certification. This is an overview. We teach a 2-day class in hypnothesia, training and certifying doctors for medical professionals, including anesthesists, nurses, and so forth. But today, we're just going to give you the overview. Midwives. This would be an excellent addition to their palette of things that they offer. You imagine a midwife that offered hypnothesia? It would be pretty cool. So we're giving this introduction and giving you an insight into the process of hypnothesia. Today we're going to compress a full 2 days worth of med school lecture into 50 minutes. So take notes. I'm not going to give the history of hypnosis as a viable alternative to or as an adjunct to chemical anesthesia, but today we will show you our approach, how Dr. Chamberlain and I do it, and with the type of inductions that we found to be most effective. Dr. Chamberlain probably has me skunked into the most complex one that I know in recent history, because Dr. Chamberlain hypnotized me to have body cavity surgery. I didn't have a little incision through the belly button. I had a 5.5 to 6 inch incision, and this was done in a hospital. And she hypnotized me, and she was quite a rock star afterwards. They'd come and take a look at me in the recovery room. There's nothing really to recover, but then they asked her all the questions. I was really jealous. Extremely important to know how to keep the patient in a somnambulistic state. Yesterday, without you being aware of exactly what we were doing, every one of you brought somebody into somnambulism. If we'd have told you where, you probably would have had, well, what if this, what if that? You just did. Now, you can't allow them to drop into sleep for the 45 minutes to an hour. Sleep is not what you want. Because if they're asleep, they will feel pain. Probably there's somebody in this room that has a bad back. Have you ever had your bad back wake you up in the middle of the night? That's the difference. So you want them somnambulistic. We'll also discuss the shorter procedures such as a retinal biopsy or injections into the eye for macular edema or macular degeneration. I hypnotize myself to have injections into my eyeball. So I was downstairs. I asked him to shut the lights out, and I hypnotized myself. I said, you can come in 2 minutes, and when you're done, say, I'm done. Say those words, I'm done. That was how I came out of hypnosis. I laid back, took myself into hypnosis. I never even saw the needle. Certainly didn't feel it, but I never even saw it. So when talking to a patient, though, one should use their first name often. You're doing great, Sam. Feeling wonderful. Advise the doctor in your pre-procedure meeting before the surgery that your voice and his voice should be the only ones that the patient hears, not the banter of OR personnel. Hey, did you see that Braves game last night? Oh, did you see something on American Idiot? You don't want any extraneous talk in there. You need to judge trance depth frequently by lifting and dropping their arm. Don't let them fall asleep. If they did, during the surgery, they'll be awakened by the pain and most likely will panic. And they'll have lost the belief that hypnosis and you probably won't be able to re-hypnotize them. It's a balancing act between keeping them deep enough and not letting them slip away from you. Now, I always ask the person in the pre-op room, do you mind if I hold your hand? So that means I'm under the drapes with them. I'm holding their hand. And that allows me to pick up their hand throughout. Should you move far enough, and I'm getting a little beyond this, I also ask for them to put a monitor so I can see their BP and their pulse. I want to know where they're at. I'm also speaking to them throughout and not letting them slip away from me during the surgery. Your mouth will be dry when you're done because you'll have been talking anywhere from 20 minutes to an hour, using their name. Feeling great, Sally. Deeper, deeper, much deeper. My deepener is apparently not caught on very much in the world of hypnosis because I read all these deepeners people use. All I do is say deeper, deeper, much deeper. Feeling wonderful, very much deeper. Allow yourself to go. It's all right. Comforting, relaxing, soothing, and encouraging them. Deeper, deeper, much deeper. Perfect. You're doing great. Beautiful. Feeling wonderful. Such a pleasant heaviness. Now those words, I'm using those the whole time. Repeating it. Confidence on the part of the hypnotherapist is paramount. There is no room for doubt or timidness. Confidence allows us to perform at our very highest level. This cannot be overemphasized. Now, some of you have questioned whether or not you should do hypnosis demonstrations if you're speaking to a Rotary or somebody someplace else. And I say, you can do this after you get to the point where you are not frightened of these people. Because if you're in there and you're scared and you're nervous, I wonder if this will work or not, you probably are going to have problems with having good results. This cannot be overemphasized. Confidence. Confidence. I had a man call me once and wanted me to do hypnothesia for colonoscopy. Can you do hypnothesia for me? I have to have a colonoscopy. Well, I just don't really have time to do much traveling. And I says, what hospital? He says, Kennestone. Apparently it's a larger hospital than when I first moved to Atlanta, where it was mainly a first aid station, I think. So I told him I couldn't travel that far to do it. He says, well, where do you do these? I says, if I do something like this, it'd be Emory. So I thought the whole thing was over. Well, he calls me back 3 weeks later and says, it's all set. He says, what's all set? For you to do hypnothesia on me at Emory. I talked to the doctor, and he says, oh, yeah, Dr. Yeah, that'll be fine. So I went in there, and if any of you ever had a colonoscopy, okay, generally there's just the doctor. You generally need to be present. They can't do those virtual yet. And a nurse, maybe one other person. I went in there was 20, 21 people, 22 people in there. And they all were curious about this. I hypnotized the guy, and I kept deepening him and instilling confidence in him. And I had him in total hypnosis, somnambulistic. Now you've seen our demonstration videos. I then says, now, so-and-so, I'm going to count up from 1 to 3. But you're still going to be in hypnosis. So I want you to open your eyes. And I count up 1, 2, 3. You're still in hypnosis. You're feeling very good. No anxiousness. No discomfort. Feeling absolutely perfect. Then a doctor mouths to me, he couldn't do this because his eyes are open. I says, that's fine. You can do this. So he did the colonoscopy. And then I counted the guy out of hypnosis when it was done, making sure that he'd remember, he'd have no discomfort, and feel perfect, just like nothing was done. When I was dressing out in the doctor's lounge, the doctor said, I can use you every day here, at least 4 days a week. I says, well, I can't come. I have a practice. He says, and we went back and forth. Finally, he says, will you do one more? I says, yeah, I'll do one more. I says, that'd be for you, right? He says, yeah. So we did him, but I says there'll be strings attached. He said, I'll pay you. I said, no, but there'll be different strings attached. So I knew I've had this hernia that I've been putting off for years because I don't like general anesthesia. When we were done, I says, okay, here's the deal. I want you to recommend this to 3 surgeons that you know, 3 general surgeons. Tell them what you've observed from the other time and tell them what you experienced. And so that's how we set it up that Inga could do hypnothesia on me in a hospital. Now, your mind cannot drift. You've got to continually be deepening them, encouraging them, instilling confidence and comfort in the entire surgery. You just can't let your mind go away to doing something else. This has to be paramount in what you're doing. So you're watching the monitors, you're looking at the BP and the pulse, you're looking at the monitors of the surgery, because everybody can see there's several large screens in there. I don't tell them that. There's those that are having colonoscopies. I say, I'm not going to see your hiney. I'm going to be by your side, not by your head. But you certainly can see their anus or their penis or whatever else they're doing, working with them on. But I never tell them that. So you're going to be doing this all the time. You're going to feel thirsty. And most places are not going to allow you to have anything in there because they don't want you to spill something on the field. When you are in there, you'll be gowned, or at least in scrubs with a mask and a hat. Don't touch anything. Don't point to anything. The only thing I ever touch is the rails on the bed, and I'm holding the patient's hand and lifting it up. Maybe bringing it out to scratch my nose occasionally. This is a sterile environment, and you don't want to embarrass yourself. Again, you cannot allow your mind to drift. Now here's something else. If the doctor needs to have the patient move their head, have the doctor tell you, and you will tell the patient. Why is that? Because when you hypnotize this patient, they are going to be in full body catalepsy. And they're not going to be able to, the doctor's not going to be able to move their head. So he'll nod you and say, will you have them move their head, or will you have them rotate their eyes? So you tell them, okay, now Dr. Ray is going to want to turn your head to the left, so you allow your head to move to the left. Dr. Hayes wants you to keep your right eye move clear over to the right. That's a very hard thing to do. Hold your eyes to the left or right for 30 seconds once, and you see how tiring it gets. Well, they do it for maybe 20 minutes. Kind of like in our arm lift thing. You know, we're talking about other things. Hold your arm up sometime while you're watching television for a half hour and see how it feels. But I've had people hold their hands up in demonstrations a lot of times. Also, you must let the patient know that you are the best and that you will enable them to experience a discomfort-free procedure. Do you notice how I never use the word pain? We never refer to pain. We never refer to pain management. If you say there's pain management, that implies there's pain left to manage. Now, there'll be other things in the very beginning that you need to think about. They are wheeled in there, and I immediately start leading them into hypnosis. But I tell them what to expect. Now, Nurse Michelle is going to cleanse the area around your eye. Now, this is like alcohol and cold, and people often don't like that. It's going to feel very soothing. You're going to enjoy this. After that, they're going to block off your eye from the rest of your head and put a cover over you, it's going to feel very cozy. Now, I've had heart procedures before and you don't generally like something over your face, so you tell them what's going to happen. You're going to feel very cozy. There's going to be a time possibly when Dr. Stoling is going to tell you to look at a light. I want you to involuntarily keep your eye on this warm, encouraging, comforting light. This will just be automatic. Your eye will be on that. And I've had Dr. Stoling downstairs and Hayes all say that they have patients in general anesthesia that move more than somebody who's in hypnosis and full-body catalepsy. So we call it pain mitigation. But during the pre-talk and the actual procedure, always say free of discomfort. Never use the word pain. Before the patient is hypnotized, the hypnotist will be instilling in the patient, by way of the pre-talk conversation, confidence in you, the hypnotist. Now, this feels weird to many of the people that come to our classes, because they've been taught not to brag themselves up. Don't be stuck up. Just who do you think you are? That's instilled in people. And so you know that you're kind of reluctant to blow your own horn. Well, if you don't blow it, nobody else is. You, the hypnotist, will instill confidence in you. It has to be, and that hypnothesia works without question. And that it's a very effective alternative to chemical anesthesia. And it's not going to leave you groggy. And it's not going to leave you constipated either. I can remember the first one I did in this building. I was coming out of the elevator on the first floor, and I hear this voice saying, "Dr. Crow, Dr. Crow." She says, "You may not remember me, but I saw you at Scottish Rite," because there's certain things we were doing over at Scottish Rite for a period. And she says, "My husband Sam had the twilight." That's what they tell you it'll be. Oh, this just be twilight. Put you down and come right back up. And that was 2 weeks. He still had this in his system. And people don't like that. She says, "Would you hypnotize him?" And, of course, said that I would. But allow me to share with you an experience from my own life about the importance of confidence in the doctor. I had just been in a severe sporting accident. Big time. It caused a heart attack. I had impacted so severely, my heart was thrown against my sternum, and I had a coronary. It was down in Piedmont Park. I was rollerblading for the first time, and a little toddler went out in front of me. I didn't know how to turn, so I just wrenched my body into a big grass bank, just like that, and wham, did I hit hard. I don't know exactly, but from riding bikes, I think I'm probably doing 21, 22 mile an hour, and now I'm stopped. I got back on my rollerblades and coasted down to the water fountain to wash the dirt out of my eyes and nose and mouth and everything, and I just felt strange. That's the only way I can explain it. So I took the rollerblades off. That was the first and last time I ever did it, and started walking in my socks up to the opening to Piedmont Park. And as I'm walking up there, I'm starting to feel pain in my chest. I broke some ribs. I kept walking, and it kept getting worse. And I thought, well, I broke my sternum. And I made my way almost up to the front of Piedmont Park, and I started throwing up. And a mounted policeman found me, called ambulance, and I'm off on my way to Piedmont. I was scared. The dome light had disappeared down to about the size of a little pen light. And I could hear them all talking to Piedmont. Piedmont, he's 80 over 60 and falling. He's 60 over 40 and falling. Piedmont, he's 50 over nothing. Then I heard them say, we lost him. I'm still in there, though. And then they did the paddles, which really wrench your back. You only think you've had your back wrenched, but when they do the paddles sometime on you, you know what back wrenching feels like. And I am scared. Scared I'm going to die. I had nobody in my life then. I was newly divorced. I had nobody in my life. Got to the hospital, and as they were backing the ambulance back in, one of the doctors had been leaving. He was a cardiologist, world-famous cardiologist, Dr. Carl Jacobs. Saved my life a couple times. And he's going past the emergency room, and he's listening to the radio chatter between the ambulance, the emergency room. So he come out, and he took both of my hand and both of his, and says, I'm Carl Jacobs. I'm the best there is. You're going to make it. You hang in there with me. Now, do you understand the confidence? He could have been an orderly. He could have been anybody. But the way he talked. So, yeah, I did survive. When I had the cardiac arrest years later, I had a couple other incidents before that were balancing things out, taking my blood pressure. You know, I recommend all you people take your blood pressure 3 times every morning. Always. And I took my blood pressure one morning, and they all have the pulse thing on it. And it shows my pulse. My blood pressure was fine, but my pulse was like 200. I says, Inga, I don't think this is right. I remember that being awfully high. So we went down that night or that day to Piedmont. I talked him into letting me go home. They wanted to keep me there for 3 days. And he says, you're going to need injections. Oh, Inga can do that. The injection is in the stomach. I don't know if you ever had an injection in the stomach, but it wasn't fun for either one of us. You know. It wasn't hours of fun for the whole family. But anyway, we got home, and I had cardiac arrest, as you all have heard, December 7th, 2007. And they couldn't fly me down into here, so they took me to Gainesville, which does have a good cardiac unit, but it didn't have my doctor. So Inga's on the phone with Carl. And says, Carl, can you come up here? He says, I don't think they're going to like that much. And now here's determination. Remember the first time I did hypnothesia? There was a first time, wasn't there? You with me so far? Nobody ever told me how to do it. Right? I didn't know how to do it. I just did it. So I went out of that hospital up there after I'd come out of the coma. Been in a coma, I think it was 2.5 weeks. And after I was out of the coma, it was coming up on New Year's Eve. I went out of the hospital. And they says, well, we can't get you out of the hospital. You can't be released. You need to be on a machine. I says, well, I'm just reading here. You have machines for that now. I said, bring me my chart, which they were reluctant to do, but they did. What I was looking for in the chart was anything they'd messed up with on paperwork and wasn't signed or documented. So I had 4 or 5 things in there. I said, listen, I'm non-litigious, but you know, this was not filled out, and this, and this, and this. So in exchange for me ignoring that, Inga located one of those boxes that you put on me. And then remember the harness and all that? Yeah, put a vest. She located one up somewhere in Tennessee, and anyway, we got it down there. Why? How? Because that was my determination. You've got to have that. You don't take no for an answer. Write this somewhere where you'll find it again. Policy is a guide for fools. No, you can't do it. It's not our policy. Now, we suggest limiting your hypnothesia, to colonoscopies, cystoscopic exams, and ophthalmic procedures. Practices that have surgery centers are the ones that generally work, not hospitals. Now, if you're known, we have a little different deal, and we can get into teaching hospitals. You might want to purchase the book Hypnosis and Ophthalmology by Dr. Harry Morgan. I think I have a copy, and what's it dated? Was it dated? It was dated University of Pennsylvania, and I don't know, a long time ago. He was a pioneer in using hypnosis for ophthalmology. He only used it because when he was doing surgery in the 50s on eyes, they were still using ether. And ether quite often would cause people to regurgitate. And when they regurgitated, they often would pop their stitches. So that's what his first interest was. Then he used it to tame down the anxiousness. And then after the surgery is done, he'd hypnotize people into rushing blood to the site. I do not use rapid inductions, neither does Dr. Chamberlain, for procedures like colonoscopies, cystos, and eye procedures. Soothing, progressive relaxation inductions are far superior in mitigating the anxiousness of the patient rather than instant or rapid inductions. If I have the time, I also meet with the family first, with them in the waiting room, especially if it's eye surgery. I was sitting around there with a hairnet on, or not a hairnet, but shower cap, boots, plastic boots. And I said, oh, this is going to be a piece of cake. You're going to enjoy this. You're not going to have any anxiousness, none whatsoever. You're certainly not going to have any discomfort. Remember, the induction is not only for the patient to enter hypnosis, but to remove worry, fear, doubt, and anxiousness. Again, as you, the hypnotist, will be judging trance depth during the procedure by lifting and dropping their arm. I was watching somebody that we had certified, and you're watching, you are alert totally. And so this individual, she was doing the hypnothesia, and the doctor was doing something, and I saw both the patient's legs lift up. Well, I knew he was in discomfort, and so I just stepped over, started soothing him and dropping him deeper and deeper and deeper. Now let's get into the hypnothesia itself. I ask them if they've ever entered hypnosis to their knowledge. I tell them, you will love it. I say that hypnosis is a naturally occurring state, like daydreaming. In fact, it is controlled daydreaming. I tell them they'll emerge from hypnosis refreshed, renewed, and alert, not groggy. And as an added bonus, there'll be no constipation, as many experience with chemical anesthesia. You notice that you'll notice that you'll be free of fear, you'll be free of worry, you will be free of anxiousness. So you're saying this without even hypnotizing them, aren't you? These are the pre-suggestions, kind of like a pre-talk for surgery. When the surgery is finished, you open your eyes feeling completely refreshed. Often we'll do them free body catalepsy while they're in the pre-op. I was working with Dr. Hayes once, and I was watching him and showed him what to do, and he had the patient in full body catalepsy. And then he pulled him out of one pre-op room down to another where they were going to do another procedure. And they were about a half hour in there. And he kept talking to him. He didn't know you couldn't do this. He then took they took the patient out of there and then did the surgery in the OR. Now the music to use is not Dr. Chamberlain's favorite jungle sound. No, you want to use somewhere in time. Now Dr. Hayes thought he had music that would be just as good, and it was massage music or spa music. It's not just as good. You want to use something that will have them go into high amplitude alpha waves, so use that. Thunderstorm probably wouldn't be as good for this kind of thing either. After they emerge, I tell them how well they did. If they can't open their eyes, I tell them that the reason they couldn't open their eyes was because of the power of their own subconscious mind. It had nothing to do with me. This is in the pre-op room. I always have a short visit with the nurses. You don't want to be on their turf. So I always make sure that they're done doing whatever they want to do. And I'll be leading the patient into hypnosis. Some of the early surgeries we did down there, you just see them rotating in through the room. I'd see 10, 12 people at one time come in and take a peek, and then they had to go on because the one behind them they wanted to see, and they're putting their masks on. So I let them know I won't be interfering with them. I wear scrubs, and again, first visit the patient in the waiting room before we go into the prep room. Why to go into the waiting room? To give comfort and confidence to them, to relax them, reassure them, and their family. You cannot forget they are scared, and they continually need to be reassured. The next time that they see you will be in the prep room. Again, I am confident and relaxed. They need to see and feel your confidence and your self-assuredness. They don't need to see fear, do they? Once the prep work is done, I tell the nurses that I'm going to lead the patient into hypnosis. I then hypnotize them for the first time in the prep room, just like we talked about. I then bring them up, except for when the surgery is being done, and I always count up 1, 2, 3, 4, 5, but not that fast. I generally walk alongside the gurney into the operating room. I take a position on the opposite side of the OR table from the surgeon. Most often I'll have a boom box playing somewhere in time. I nod to the surgeon and begin leading the patient into hypnosis. And then I use the deepeners that we've been talking about over and over and over again. Simple, deeper, deeper, feeling very good, very refreshed, very relaxed, just feeling wonderful. You keep doing that throughout the entire procedure. And that concludes this presentation.